Welcome to the South East Nursing Global Majority Programme. In a moment, I'm going to pass the baton to members of the Nursing Directorate teams who will do a bit of an overview of our achievements to date through doing a look back, but also set out the priorities for us across the South East of England into the year ahead. What you will see, no doubt, as we work through the overview, our priorities and the achievements today is that race equality matters in the South East of England as it does in every part of NHS and social care delivery. We know that there is a strong evidence base of the significant health disparities among different racial and ethnic groups and those from a global majority, often experiencing poorer outcomes. So we have to continue to work and to focus on that in terms of our service delivery to ensure equitable healthcare provision for everybody. It's really important that we continue to create positive environments in which staff feel valued, respected and supported, and through that reduce the risk of discrimination, harassment and workforce and workplace inequalities.
This is a very important and high priority program for us. We have key objectives across the program, such as implementing our combating racism strategy, also making sure we are working with the regional and national EDI team to implement the high impact action for EDI, as well as working with our integrated care system to align EDI with health inequalities improvement and other related areas. And we're really looking forward to working with some of you as we move forward to address and deliver this very important agenda.
I've worked closely with the Nursing Directorate and with the Nursing Professional and Systems Development team to identify key priorities for the Global Majority Programme for the South East. We've identified 3 areas that we want to focus on as a region, namely supporting development of anti-racist cultures in the region, recruitment, retention, identification of talent, and also ensuring we benefit from diverse leadership in the region. And finally, responding to the Learning from the Michelle Cox Employment Tribunal, which was published earlier this year. We're excited to work with all the systems across the region to fulfill our aspirations to ensure global majority nurses and midwives thrive and achieve their full potential.
We've had the opportunity over the last 5 months or so to really reset and review the programme. And to do that, we've been able to engage with our stakeholders to understand what their needs and wants are. And we've also had really strong commitment from our regional leadership team within nursing to enable us to really start to think about the programme and how we want it to progress. The themes within our programme really align with the Chief Nursing Officer, Chief Midwifery Officer, Ethnic Minority Action Plan. And I suppose to spell those out for us, they are that we absolutely want to protect people from harm. We want to make sure that people are treated fairly. Our third theme is around increasing the diversity in leadership. So we're absolutely keen to make sure that the leadership of our nursing teams represents the populations who it serves. Thinking about the tools then, so the enablers that we're using to make sure that we meet all of our objectives and our aims. So thinking through our areas of focus in the South East, our first is in relation to our executive and senior level nurses. For our middle grade and senior nurse leaders, we're supporting a senior nurses network, which is focused really at nurses from the global majority at 8B and above. For our band and 5 and 6 nurses, we're working really closely with our regional international recruitment fellows. Moving into the how are we delivering all of these areas? And it's an enormous amount of work in terms of making sure that we really make the improvements where we need to. We're absolutely delighted in the South East to have been able to appoint 2 Chief Nursing Officer, Chief Midwifery Officer, Black, Asian and Minority Ethnic Strategic Advisory Group Leads. We have a number of nurses across the region who've benefited from undertaking the Getting to Equity programme and who've learned enormously from that programme, myself included. We're working really closely as well with our colleagues who are supporting internationally recruited nurses and healthcare support workers, and that's within the region. We've developed our own mentorship pool, and that's openly accessible through our future NHS site, because we really want to make everything that we do really accessible and easy for people to see and to access. And our next step now is to plan and implement some events, because we really want to celebrate our achievements to date, but also to have the opportunity to really listen to people so that we can co-produce our next steps. My colleagues now will go on to talk about a bit more detail of some of the areas of focus, and we've just absolutely delighted with what we've been able to progress so far, but really recognise we still have a long way to go.
The purpose of the Nursing and Midwives Global Majority Network is to enable our staff to excel in their chosen career area at pace while respecting individual needs. To improve our workforce race equality standard, for example, representation in senior pay bands, access to training, and reducing wider disparities in recruitment. Also, the aim is to align with national objectives to accelerate retention and develop a global majority leadership pipeline and offer a long-term career enablement framework for our skilled staff who are underrepresented.
We are about finding out what are the blockers for career acceleration. How could we support people to be their best and optimize their potential? And to do that, we've gone through a process of collecting enough data that helps us now devise targeted interventions like self-discovery, the psychology of now, some talent interventions, a supportive network where they can learn and grow and share. And I'm really proud in this region to have support from our chief nurse and midwife for the Southeast, or regional chief nurse and midwife, and our senior colleagues like our chief nurses across the patch.
Reflecting on what we've achieved over the last 12 months, as a collective, we are particularly proud about what we've achieved as a group in offering mentorship, coaching, and networking opportunities to our senior nurses and midwives from the global majority. As a group, we've taken a holistic view in supporting not only the senior colleagues, but also thinking about the junior colleagues who are coming in the pipeline.
I am here to talk to you about the Getting to Equity program. It was a wonderful, inspiring experience for me. I had the opportunity to meet those who are in fantastic leadership roles in nursing, help me think about what my next steps might look like. And I also had the opportunity to meet some of the NHS's brightest stars. I had a chance to network with colleagues and peers who, just like me, are aspiring to grow and to develop in their career. It was a really great experience. It certainly added value to me and my work, and I definitely would recommend that program.
Joining the fellowship has given me so much benefit and support, which I'm so grateful for. It has given me the awareness of the support for internationally educated midwives, giving me the ability to know what is happening in other trusts and how other trusts are working hard towards supporting internationally educated midwives, and what other trusts are learning, the good practices other trusts are learning from each other to help make adjusting for internationally educated midwives easy. The fellowship has greatly benefited me. One of it is it has boosted my confidence in speaking in public, which previously I always used to think about what to say, trying to make sure I'm saying the right thing and at the right time, trying to be prim and proper. However, going through the personal presence and impact with the RADA through the Florence Nightingale Foundation. I've been able to build my confidence to speak in public, and I'm really happy for that. Thank you.
As you've heard, we have a number of work streams and programs to deliver as we move forward. Key points is delivering on our ethnic minority or global majority action plan, also driving forward the 8B and above action plans and outcome, also implementing the anti-racism strategy within the Southeast, and working with the senior nurses and midwives to deliver that ongoing program, and supporting our strategic advisory lead as we move forward. Thank you for listening, and I look forward to working with you as we move forward.